Good afternoon. This will be a brief update today, and I'd like to start again today with saying that we have no new positive cases for Prince Edward Island for COVID-19. We have 119 new negative tests, so still at 26 confirmed positive COVID-19 cases for PEI, and 24 of which are now recovered. And of course, we contrast that with what is going around around the world with 2.6 million cases of COVID-19 and over 184,000 deaths. And in this country, more than 40,000 cases and more than 1,900 deaths. As I mentioned yesterday, we're looking closely at how to increase our testing here in Prince Edward Island. And it will be key, along with strong screening measures at our points of entry, that we have this in place before we start easing back other restrictions. And I'd like to note that we have capacity to do up to 2,000 tests a week here in Prince Edward Island. And again, that has really increased over the last number of weeks. I met yesterday with Dr. German and the laboratory team, as well as members of our office, to discuss new criteria for screening and additional groups that could be tested. And so we'll be updating and looking at these guidelines and the criteria around them. And I thought it just may be a good time to mention who we do test here in Prince Edward Island, and it's fairly broad. So any person who presents with new onset of cough, fever, sore throat, runny nose, or marked fatigue can be tested, and that's regardless of travel history. Admitted patients or those in the intensive care unit with any respiratory symptoms would be also considered for testing for COVID-19. Healthcare providers with symptoms, and this is one area where we are looking to increase testing, adding healthcare providers who have traveled outside the province, certainly offering testing. And we'll be reaching out through Health PEI and for instance, to try to figure out how best to approach that and identify healthcare providers who will be traveling, although we will know from the screening points healthcare providers coming into the province. Of course, we're already doing testing for those who are being admitted, residents being admitted to long-term care facilities, and of course any resident of long-term care facility with symptoms. The intention, of course, is to do residents and staff of long-term care facilities if they are close contacts of a case. And this is also an area where we have talked about, and we will be reaching out through Health PI, and Marion will be reaching out as well for staff who work at more than one long-term care facility, doing regular testing for these healthcare providers. And I'm sure that this will actually healthcare providers will be interested in having this available so that they can protect their patients and, of course, their families and co-workers. We already had made a decision to test temporary foreign workers in Prince Edward Island, and of course, contacts of cases. We've already been doing that. And this is another group that we've talked about briefly here, but we'll be talking about more. So we'll be reaching out through the Truckers Association today to have a further discussion about testing long-haul truckers who reside in PEI when they return. And again, looking forward to those conversations, but I'm sure they'll also be interested in the opportunity for more testing in order to protect their families and our community here. And although there aren't many residents from PEI who are returning from international travel, if they are, they also will be considered for testing. So I think the conversation will continue. We'll be continuing to look at who should be tested, but I think that it's really a good discussion, and we're in such a fortunate position that we have the capacity here and need to have that capacity as we go forward in the weeks and months ahead. I would like to acknowledge the loan of what is called a Kingfisher specimen extractor and a BioRad PCR machine from the Atlantic Veterinary College, as well as supplies provided from the Canadian Food Inspection Agency. And these equipment and supplies will allow Health PI maximum flexibility and redundancy to respond to our testing needs and strategies in the weeks ahead. And I specifically would like to recognize the Dean of Faculty of Veterinary Medicine, Dr. Greg Keefe, and Liz Dobbin, AVC Director of Diagnostic Services, as well as Pamela Ross, CFIA Director of the Charlottetown Laboratory. And again, this will just add to the capacity of the laboratory. It's always easy when we haven't seen a new positive case for a while that I worry we'll become complacent. It's been over a week since our last case of COVID-19. But to get to the point where we can begin to ease restrictions, we need to continue doing what we are doing. And this means, of course, at this point, still self-isolating when required, practicing physical distancing when we have to go out, and staying home as much as possible. When we talk about reopening PEI together, it's not started yet, but when it does, it will be cautious, gradual, and we have to do so carefully. I know we all are looking forward to, I am looking forward to some easing of public health measures in early May. But I'd like to reiterate there will be a process in place. It'll be a process to go through with industry, organizations, businesses. And it's really what we're doing is going from essential versus non-essential, which we've talked about for a number of weeks, to a risk-based approach, and trying to do so in a way that keeps our whole island safe. We are several weeks into this pandemic, and I know we've all had to make so many adjustments. And I know it's not been easy. But I'd like to thank Islanders for their adherence to these public health measures, their patience and understanding, and thank all essential workers for their continued dedication. And I think we'll need these same things in the weeks ahead as we approach changes with public health measures. We'll continue to need adherence, dedication, understanding, and patience from all areas. Thank you very much. Okay, bonjour. Encore aujourd'hui, il n'y en a pas de cas nouveaux de COVID-19 ici à l'île du Prince-Édouard. Nos chiffres restent pareils, donc c'est une bonne nouvelle. Mais on voit autour du monde, il y a maintenant 2,6 millions et plus de 184 000 morts. Et dans notre pays, il y a plus de 40 000 cas et plus de 1 900 morts. Quand je vous donne la bonne nouvelle qu'il n'y en a pas de nouveaux cas, je suis en même temps très inquiète parce que je ne veux pas que les insulaires arrêtent de faire ce que leur sont demandés à tous les jours. Je sais que tout le monde a bien hâte le commencement de mai parce que ça sera le début d'un relâchement, mais je dois me répéter que le combat contre le COVID-19 n'est pas du tout terminé. On doit continuer à respecter les consignes pour qu'on puisse être certaine qu'un relâchement est possible. Quand ce sera le temps de mettre le plan de relâchement en mouvement, on va devoir le faire petit à petit et avec beaucoup d'attention. Hier, je vous ai mentionné qu'on est en train d'évaluer comment nous pourrions augmenter notre capacité pour faire les tests. Et ça sera un élément clé de concert avec les contrôles aux frontières qui nous permettra d'envisager et de mettre en marche les mesures de relâchement. Et on a discuté avec Dr. German et son équipe à laboratoire et notre membre de mon bureau pour discuter des nouvelles directives et des autres groupes qui seront testés. On a de nombreuses questions sur les... je vais peut-être manquer ça juste parce que c'est... je sais que j'ai mentionné déjà. Depuis des semaines, on a changé notre façon de vivre. Ça n'a pas été facile, ça ne l'est pas toujours. Mais je voudrais dire merci encore à tout le monde pour votre part. Et merci aux travailleurs essentiels pour votre implication. Merci beaucoup. And I'll turn it over to Marion.
Thank you, and good afternoon, everyone. As I stated yesterday, we at Health PEI continue to evaluate and plan for the return of some services across our system in the coming weeks. We need to do this safely, balancing the need to provide ongoing essential services and maintaining the capacity for a possible COVID-19 surge. We also need to begin to provide services that have been put on hold, but now may safely be done or need to be done because patients have been waiting. Risk assessments on any healthcare services that will be reintroduced will be done by Health PEI clinical and operational leadership and will have input and direction from the Chief Public Health Office. We also continue to keep a focus on resident safety in our long-term care homes and ensure the safest protocols are in place there. So I look forward to working with Dr. Morrison on the new testing procedures that will be coming. The cough and fever clinics are continuing and drive-through testing sites in both Charlottetown and Summerside, and appointments to these clinics are available through 811 or your family physician or nurse practitioner. When arriving at the clinics, just a reminder to remain in your vehicle until you're notified by staff to enter. I want to remind people that Health PEI does continue to offer essential services, and that means that many programs and services are still available. If you've not been notified that your appointment's canceled, please call ahead and ensure it's on. If you do have an appointment, please attend and receive care. Services that are being provided are important to maintain the health of Islanders. We do want to ensure that while we respond to COVID-19, Islanders stay otherwise healthy. We don't want to see an increase in health issues that are unrelated to the coronavirus and indirectly may be a result of this pandemic. Our hospitals and healthcare services are safe, and we are there for you when you need us. I'll remind you that urgent and emergency care, as well as all other essential services, are open. And if you have an emergency, call 911 or go to the emergency department in your area. Thank you.
Thank you, Marion, and we'll open it for questions.
Nicole Williams, CBC.
Hi, Nicole.
Hi to you both. My first question is, or both of my questions are likely for you, Dr. Morrison. The first is, are there any circumstances in which people who do not live here, but let's say they own a second home, would any circumstances be deemed essential for them coming here? Like a lot of people are saying that for property maintenance reasons or for insurance reasons, they feel like they have to come here.
So, Nicole, I think that's it's a really good question, and and I think our answer will evolve in the next couple of weeks. At this point in time, we have, with the state of emergency, really tried to clarify whether travel is essential or not. And I think these are the kinds of questions the Emergency Measures Organization is getting. And and I think they're tough, and they're trying to figure it out as well. So I think of course there's reasons that do make things essential. Some things can wait until a little bit later in May, for instance, and so some may not have to happen today, and so those are the kinds of considerations I know the Emergency Measures Organization is looking at when they're trying to answer those really hard questions.
So just to clarify, it's possible that at some point in May, people from out of province who have a second property here could come here for those reasons?
Well, I think we're going to be looking at, of course, the state of emergency, the public health state of emergency, what's going on in our neighboring provinces, what's going on here, and I think of how much has changed every week in the last number of weeks, and so we'll be looking at all those things every week, every day going forward. So it's possible, but we want to recognize that one of our risks of importation of COVID-19, or our risk of importation of COVID-19, is at our entry points. So how do you balance trying to make sure that people get here when they need to, but are certainly able to isolate and self-isolate appropriately with supports, and do they really need to come? So I think, Nicole, it'll be ongoing discussion, and absolutely 2 months ago, we wouldn't have thought we would be in this particular position, and we have done an amazing job as a province right across all parts of it to try to minimize the impact of COVID-19. So how do we go forward and try to continue to minimize the impact of COVID-19, but recognizing that people do want to come here, and many people need to come here?
Thank you. For my second question, I'm wondering if you can just clarify about those who live on PEI and have a secondary residence, like a summer cottage. Are they allowed to move residence or go back and forth between properties?
Well, it's someone else close to me asked me the same question, and I think right now the risk is certainly more from outside the province in terms of getting COVID-19. But some of the other part of that is that we've been asking people to minimize how much they're out and about to try to reduce the risk. So when we talk about in the weeks ahead about easing up measures, I think that's exactly the kind of thing that needs to be clarified, along with the importance of how we socialize with each other, and it's about movement. So not just it's movement within PEI, but it's also movement and interactions with others. So, Nicole, I think we'll have a chance to really clarify that and be much more specific about it very, very soon, and certainly in early May.
Thank you so much.
You're welcome. Thanks.
Louise Martin, CBC.
Good afternoon to you both. So Dr. Morrison, there seems to be a lot of confusion about the gatherings of over 5 people are prohibited rule. I've had a lot of messages about this. So some people take this to mean they can go visit family and friends so long as it is a group under 5 people. Can you clarify that, and can you be charged if you're caught in a gathering of over 5 people?
So, hi, Louise. So the wording in the order, I don't have it right in front of me, but it is gatherings of more than 5 people are not permitted if they are not members of your own family. And I was worried at first that I wouldn't be able to, I'd have to have one of my family members leave the house, but because we're a family of 6. But no, it's for those who are not in the same household, and if you gather for more than 5 people, it's not permitted. But the exception, of course, being if you are working in a hospital or a health or care or social services area. Of course, there would be more than 5 healthcare workers in a setting. And that's the way the order is at this time. And it's Nova Scotia would have the same wording around its order, or very similar wording in terms of the number 5. And if in terms of the way the order is written right now, it's possible that a charge could be laid, but it's really, that's not what we would start with. It would be around, I know the enforcement would give a warning and find out what was going on before any charge would be issued. Does that help clarify?
Just to be clear, because some people are saying, so it's gatherings over 5 people are prohibited unless they're family members. So I think some people are saying,
yeah.
Is that right? I'm
It's
just making sure
if it's of your own household, so people who live under the same in the same household setting.
So the advice still is you can't go over to a friend's house to visit them. You shouldn't be doing that.
Not yet. But
Okay.
I mean, I think that's part of what we talk about when we talk about easing up, how important that part is in our discussion. So it's not just around a particular sport or activity, but it is also going to be part of that discussion of how we relate to other people and how much we miss each other. And we've said that different times. And but we've been trying to make sure there's a period of time that we are in a good place, that we can have that discussion. So I think if we're hearing a lot of it, of course, it signals exactly what we know, that people want to see each other. But we need to make sure that we are very clear about what that means at the right time.
Okay, so stay in your bubble. How much consideration is the Chief Public Health Office giving when it comes to commercial mass gatherings, like I'm thinking Cavendish Beach Music Festival, some of the fairs and exhibitions that are coming up as early as June, and they're months, if not a year, in the planning, that need time to cancel and reschedule? Is there sort of a cutoff date in mind to allow them time to adjust, to make amendments to their plans?
Absolutely. So, I mean, we were talking about for instance, the Cavendish Beach Music Festival with our team yesterday, and I know we've been reaching out as well to some of the other events that are really have been mainstays of our community here in PEI, but not just in PEI. There are many in the Maritimes too. And so I think that discussion needs to start now, start early, and some of them are a lot more clear than others. And so we'll be responding to those going forward. I think mass gatherings of large numbers of people, many from out of province, is not going to, we've said right along, that is not a measure that we would be changing as one of the early measures. So I anticipate it will be certainly not in the first phase.
Understood. Thank you so much.
You're welcome. Thanks.
Stu Neepy, The Guardian.
Hi, good afternoon to you both.
Hi, Stu.
I guess first question to Dr. Morrison about the new testing criteria. I'm wondering, we've been talking about this, but when the new criteria will actually be put in place. And I'm wondering if you can clarify that the healthcare workers who've traveled outside of the province, who will be tested, who don't have symptoms, whether that will include long-term care workers specifically, and I guess whether long-term care workers without symptoms are still being considered as part of the new criteria.
Yeah, so, hi, Stu. So we already know long-term care workers who are coming in from out of the province are not able to go to work for that 14-day period at this point in time, or that's how it has been, that's what's clear in the order. But long-term care workers and all healthcare workers who are identified will and we want to reach out to them. This was a decision certainly that we've been looking at and talking about, but we need to reach out to the healthcare providers through Health PI, in particular today likely, and then we can start that process immediately, really, in terms of identifying those and then and the process going forward. And for some of them, for instance, there may be a couple of colleagues who work at our hospital, and they come over and they work here for a couple of weeks every month, and they go back and forth. So every time they come, it'll be a routine that when they come, they will get tested, and I think they will also be really interested in wanting to get tested because it will make sure that they're keeping their colleagues and their patients and their families safe. So I think we're really pleased to be able to do this and do it now at this stage when we don't have any evidence of widespread community transmission.
Okay, so the new criteria, when is that being put in place?
Well, I think it will be put in place by end of day. I mean, I think we have some of it's already, a lot of it is already in place, and we can post this on the website, so it's very clear. We've intended to update that criteria and have it available on the website so that it's clear for everyone, the public and the media. And but knowing that it will continue to be updated, and it'll change, and it has changed, and it continued to expand over the last number of weeks. So we will certainly look forward to doing that. I think we make these decisions because we're trying to identify and be able to isolate and do contact tracing on any cases, and so we want to do it for that reason, and we have the capacity to do it. This will make us probably one of the most broad criteria for testing, I would suggest, in the country. So we'll be looking at that. So in terms, I know you're asking me for a time, but we can certainly say that by within the next day for sure.
Okay. Thank you very much.
You're welcome.
Rachel Collier, Eastern Graphic.
Hello. My first question is for you, Dr. Morrison. I'm wondering, when do you think construction companies can expect to be granted permits to start new projects beyond essential infrastructure work?
So that's another good question. So the permits are issued by the province, of course, and not or municipalities, and not by our office. And but I expect that that process of allowing permits to be granted, so that initial planning and could be undertaken, would occur pretty soon, and I don't have a date for you, but I think that's under discussion, and I think that we anticipate that happening fairly soon.
Okay. And okay, my second question is also for you. PEI's pandemic contingency plan mentions we can expect a second or maybe even a third wave of cases. And I'm wondering, do you think it's possible to avoid this? If so, how, or how likely is it that we could avoid a second wave of cases?
Well, I mean, often in pandemics you hear there's a second wave. It's a little bit challenging because in many ways we've not had a first wave, and we have. So we will continue to monitor it. if we do have a second wave, and I think we've talked about this with Health PEI, the importance as we go forward and easing up on public health measures is to make sure we maintain enough capacity in our health system to respond to any potential in surge of cases, and that would include a second wave. So we need to be cautious and conscious of the fact that it could happen, and that we maintain a state of readiness to be able to deal with that. Of course, it's also important that we look forward and consider when a vaccine might become available, and because that could also influence whether or not a second wave impacts us in the same way.
Okay, thank you.
You're welcome.
Carrie Wynn McLeod, Ocean 100.
Good afternoon. Dr. Morrison, I just have a question about, I've had a lot of people contacting us about campgrounds in the province. There's a lot of islanders, that go spend their 4 or 5 months at the campgrounds. Right now it's listed as a non-essential service. Is that considered, is it like that because it would be considered like a mass gathering?
Well, I mean, the essential versus non-essential, and essential meaning that it was really a matter of, of your health and safety and your life, and that's how it's defined really nationally too. So that's how it was set out initially. And so the campgrounds, like we've just mentioned, will be looked at moving from an essential versus non-essential category into risk-based assessment. So I would imagine the campgrounds, like many other areas, will be getting a hold of and going through the process of a risk assessment, and that will be considered, and then the language around that, of course, will change, and it will be on a risk base as opposed to just essential versus non-essential. And so I think it'll of course evolve in the next weeks ahead, Carrie Wynn.
Okay, thanks so much. That's it. Thank you.
Great, thanks.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. J'avais une question sur les tests. Vous avez dit au début que vous voulez tester de plus en plus de monde pour protéger la population. Est-ce que dans le cas où on testerait les chauffeurs routiers, les personnes qui ont été en dehors de l'île, même sans symptômes, quelle est la capacité dont vous avez besoin pour faire tous ces tests? Est-ce que c'est 2000 par semaine ou est-ce qu'il faudrait aller beaucoup plus loin encore?
Bonjour Laurent. Pour maintenant, on a beaucoup de capacités, même pour en faire les groupes qu'on a parlé aujourd'hui, les personnes qui travaillent long-term care, les infirmières qui voyagent, viennent de retourner. Tous ces groupes-là, on a bien assez de capacité. Je sais que et on est en train de continuer de regarder pour ces groupes, mais à ce moment, 2000, on a plein. Mais ça peut changer. On garde toujours quelques tests pour, en cas qu'il y a un grand nombre de cas, une institution pour les résidents et les infirmières, mais à part de ça, on a une capacité qu'on doit utiliser pour tester le plus grand nombre de personnes possible, mais ça devrait être sur les gens qui sont plus à risque, plus de risque d'avoir COVID-19. Et à ce moment ici à l'île du Prince-Édouard, c'est les personnes qui voyagent.
Et juste une question sur le 1er mai et le début du déconfinement. Vous avez dit récemment que les terrains de golf pouvaient être continués à être préparés pour la saison. Est-ce que les terrains de golf vont ouvrir dès le mois prochain ou pas encore?
J'imagine que les terrains de golf seront comme les autres, ensemble, ils vont faire la même sorte de processus que les autres organisations, pour un assessment de risque qu'on va faire. Et alors, j'imagine qu'ils ne vont pas ouvrir le 1er mai, mais j'imagine s'ils on regarde leur plan et si c'est pas beaucoup de risques aux gens, ça va ouvrir à un moment donné, mais j'ai pas une date parce que c'est pas encore fait le processus de faire les assessments de risque.
Ok, merci.
OK, merci beaucoup.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. On a maintenant 2 cas actifs dans la province, 24 qui sont guéris. Dans combien de temps est-ce qu'on peut imaginer que la province va être complètement débarrassée du virus, qu'il n'y aura plus personne dont le virus va être actif?
Je ne sais pas au bout de la tête combien de jours avant qu'ils sont les autres vont être considérés guéris. Mais je pense, je suis en train de dire, je sais depuis quelques jours qu'on doit commencer à penser comment on doit vivre avec le COVID-19. Alors, même si on n'a pas de cas actifs, j'imagine qu'on va avoir d'autres cas, mais c'est comment on doit contrôler le nombre de cas, comment on va s'organiser pour qu'il n'y en a pas un grand nombre. C'est ça qu'on doit en y penser en faisant ces mesures tranquillement, avec soin, qu'on va réaliser une sorte de vie qui est un peu plus normale, mais qu'on aussi prend soin les uns les autres pour s'assurer qu'on n'a pas beaucoup de COVID-19. Mais j'aimerais dire que c'est peut-être la semaine prochaine. S'il n'y en a pas de cas, on peut dire qu'il n'y aura pas ici, mais je ne suis pas certaine.
Vous avez aujourd'hui invité les insulaires à ne pas tomber dans la complaisance en sachant justement que le bilan s'améliore et de plus en plus. Est-ce que vous avez observé depuis que vous et M. King avez annoncé une date de déconfinement ou une date de début de déconfinement, est-ce que vous avez observé un relâchement immédiat des règles de distance physique et d'éloignement et d'isolement aussi, sachant que la lumière au bout du tunnel, on peut enfin la voir?
C'est peut-être au même temps qu'on a fait l'annonce qu'on a vu un peu plus de personnes qui sortaient vraiment, mais je pense que c'est plutôt qu'on a les insulaires un peu d'espoir ça va changer. Et puis, je sais que le temps dehors aussi change un peu. Alors, c'est pour cette raison, on n'est pas encore là. On doit être prudent et on doit continuer pour un bout de temps. Et ça va être difficile et pour cette raison, je demande la patience des insulaires et la communauté parce que si on ne fait pas tranquillement, on va avoir peut-être des résultats qu'on a déjà travaillé fort d'éviter.
Merci beaucoup.
Merci. I'm conscious I didn't translate those last couple of questions, so I apologize. One of the questions was around we have 24 of 26 cases that are considered recovered, and do I look forward and anticipate a time where we could have no cases and everyone recovered, no active cases, and that's certainly a possibility, and of course that would be wonderful, but I'm always conscious that we can get a new case at any point in time, and how we go forward and live with the possibility of COVID-19 and make sure our system is ready for any increase in cases, but also how we manage those cases and quickly identify them will be important. There was another question about do we have the capacity actually to do these extra testing of people? And at this point, we do, and we're in a very fortunate position that we have that capacity to look at groups of people who may be at higher risk and having that opportunity to test them. So thank you very much, and we'll talk to you tomorrow.